This video is used to showcase the use of the ReLU software and AI-powered automation, segmentation, fusion, tooth movement, implant placement software into the correction or to assist us to correct virtually a unilateral cleft palate on a growing patient. So we use this software as a first step. And again, you can discover the engine that is right here. So you have, again, it's an AI powered, use neural networks to segment all the craniofacial structures. For this case, we'll use the segmentation and we'll use the fusion. There is also an alignment module, and I think there is an implant module that you can use. But for today, we're going to be using the segmentation and the fusion software only. Then we import the case into ReLU using a special software again, and then you have this interface where you have the cone beam CT is there, and you have the iOS, which is the intraoral scan that has been already segmented. You can see that right there. The teeth are segmented. The cone beam is also segmented. So now every single tooth is segmented. The mandible is segmented. The nerve canals are segmented. And you can see that the shape is pretty close to reality. We can fuse the iOS to the cone beam data and it becomes a one unit. So every tooth now has some data from the iOS and from the cone beam. Now you can export every single structure. In this case, this is the maxilla, and we add the dentition that is fused, remember? So all these can be exported now into any type of software for more work. In our case, we will be exporting it into the Blender environment, which is an open source software designed for animation, not necessarily for orthodontics. Now we imported the data into the Blender environment. The interface is completely different, as you can see. I colored the maxilla in orange and the sum of the teeth in pink and the primary tooth in green, just to show you on the right hand side every single file is there and can be selected or deselected. On the lower part, the timeline is here, and you can look at zooming in. You can see that immediately there is already the canine starting to grow into the cleft, which is not good. And the root of the central incisor, the root of the central incisor is protruding into the cleft, which needs to be, this would need to be corrected. So already a big advantage. So first step for us is to hide the root into the bone by using segmented mechanics or any type of mechanics, and kind of immediately think about grafting, because you really want to get the canine into bone, not into the cleft, which may end up not having as successful an outcome as planned. So this is the correct time to do the bone graft, even if the patient is fairly young, because the upper canine is already in, almost into the cleft, and it has to be grafted prior to the cleft. So we proceed with the bone graft. This is a virtual bone graft, and we hope to get the best possible result. You can also see on this rendering that we have extracted the primary teeth for the sake of this demonstration. You don't really have to do it right now, but for this demonstration we decided to extract the teeth. And you can see also that this tooth has been corrected in a second phase. So we started this way, remember, and now we have corrected it already into the correction of the crossbite to avoid any occlusal interference. And for the sake of demonstration, I will now remove the mandible and remove the maxilla. I mean, as a visual, so they're still there, but they're not visible anymore, because this way you'll be able to see the dentition into a 3D environment. You can always put back the mandible and the maxilla for the sake of verification. And then what we do, we start moving the teeth using the timeline and correcting the maloclusion. This was done fairly quickly. And what we also did, we extracted the upper left lateral incisor because there was not enough space. So now we have a canine substitution. And at the end of treatment, we have corrected the torque of the upper left central incisor. And we put the maxilla back into position to see what's going on in the mandible. And we can see now that the maloclusion is corrected. We did not pay enough attention probably to the lower second premolar area, and this tooth will need to be further corrected. So with the mandible now visible, we select the second premolar and we reposition it where we want it to be. And obviously this is not yet a tooth moving software that is very sophisticated for tooth movement. It may become, but what is really interesting is you can definitely now at this level import the maloclusion into a tooth moving software. I don't know, Invisalign, KLON, any type of tooth moving software, and start looking at the potential to correct the maloclusion with either aligners or braces or a combination of both. This is designed to let you better understand what is supposed to be done prior to the bone grafting and what you can expect if the bone graft is successful when you guide the dentition into its final position. So this is basically a simulation. As you can see right now, we simulate all the movements, and at the end we end up with an acceptable result that needs to be further refined.